You're disciplined. You show up. You don't skip leg day. But somehow your back didn't get the memo. Now, I hear one of two things frequently in my clinic. I've been lifting for years, doing everything right, but my back keeps acting up after deadlifts. Or I'll hear, every time I squat heavy, my back is sore for days. Here's the thing. Your back pain during lifting isn't bad luck. It's usually a sign that something in your system isn't working the way that it should. Your low back shouldn't be the center of attention during deadlifts or squats. Think of it like this. If your body was a construction crew, your back is the foreman. It's there to supervise, it's there to keep everything stable, not do heavy lifting. That's what your glutes and your hamstrings and your core are for. But when those other workers aren't showing up to do their job properly, guess who gets stuck doing all the work? Your spine. And just like that overworked foreman, usually it's going to break down. All right, so there are several lifting mistakes that can turn your spine into that overworked foreman. As a physical therapist working with active adults age 40 and over, I'm going to talk about the 5 most common ones I see. So mistake number 1 is poor bracing. Most lifters have never learned how to properly brace their core. Think of bracing like putting on your body's built-in weight belt. When you brace correctly, you're creating a stable platform for your spine to work from. And without it, it's like trying to lift heavy weights while standing on a wobble board. Everything gets shaky and your spine is taking the beating. So mistake number 2, it's a loss of the neutral spine. Your spine has natural curves for a reason, but daily life messes them up. If you spend hours hunched at a desk or slouched in your car, it can really reshape your spine. And not just change the angles or the curves of the spine, but actually change how the spine moves. And then when you get underneath a heavy barbell, the spine bends when it should be staying straight and stiff. It's like trying to stack blocks on a crooked foundation. Something is going to give. All right, so for mistake number 3, it's tight hips and ankles. When your hips and your ankles don't move well, the spine has to pick up the slack. And in a place like Houston, where I'm from, 30+ minute car rides are the norm. So this problem gets bad very quickly. All that sitting, lends to having tight hip flexors and it stiffens up your ankles. So when you go to deadlift, your spine now has to bend or twist more than it should because your hips can't move through their full range of motion. All right, so for mistake number 4, lifting through fatigue. Now, I would say fatigue is sneaky. Your first couple of reps could look perfect, but as you get tired, your form can start to crumble. It feels like when you're trying to write neatly and your hand starts to get tired, the letters get sloppy. The same thing happens when you're lifting. Your stabilizing muscles stop firing properly, and that's usually when the injuries happen. Mistake number 5, forgetting your glutes or your hamstrings. Too many lifters think deadlifts are strictly a back exercise, but your glutes and your hamstrings should be doing most of the work. And when they don't fire properly, it's like having a flat tire on your car. You've got all 4 wheels, but they're not all doing what they're supposed to do, making everything harder to control. Okay, here's the thing. These mistakes might not hurt today, but they're like that doorknob hitting a wall without a door stopper. At first, it's just a gentle tap, but over time, it ends up with a dent and eventually a hole in your wall. And the same thing happens with your spine. These small mechanical problems snowball into bigger issues. They become disc problems, muscle strains, chronic pain that can sideline you for weeks or months. If your back occasionally gets sore after lifting and then bounces back in a day or two, that's pretty normal. But if you're consistently dealing with pain during or after lifts, especially if it's affecting your sleep or your daily activities, it is so worth getting checked out. That's where I come in. When a lifter comes into my clinic with back pain, here's what we do. First, I watch you move. How do you squat? How do you deadlift? How does your body handle weight? And then we figure out exactly which of these patterns is causing your trouble. Then we get to work on the fundamentals. You'll learn how to properly brace your core so that every rep feels rock solid. We're going to rebuild your strength with those glutes and those deep core muscles, the ones that really should be doing the heavy lifting instead of your spine. We also work on opening up those tight hips and ankles, especially if you're dealing with those crazy Houston commutes that take so long. And if there's inflammation in your muscle from a previous flare-up, we're going to use hands-on techniques to calm that down. The goal is not just to get rid of your current pain. It's to give you a clear path to get you back to lifting consistently without that nagging worry that you're going to hurt yourself again. If that sounds like something that you're dealing with, especially if you're in the Cypress, Texas area, check out the comments below. I'll put a link to my clinic where you can schedule a visit to get all of this figured out. Or you can drop a question in the comments and I will personally reply. Lifting shouldn't leave you wondering if today's the day you throw out your back. It should make you feel strong and capable. And with the right approach, you can make gains without your spine paying the price. Thank you for watching, and I hope that you're having a great day. Bye.